Hello, this is Dr. Gay from First Lake MRI, and this is a 26-year-old male with injury of his ankle recently. He's got lots of swelling about his ankle. This is the subcutaneous soft tissues here. The foot, really prominent thickening edema. There's edema on the medial side of the ankle here. This is the Achilles tendon in the back, and this is the front of the foot. Here's the heel to get oriented. And on this view, we can see something on the outside of the ankle. Over here, there's a tear of the anterior talofibular ligament. So the anterior talofibular ligament bridges the distal fibula to the talus. And normally it's about right here. This is the tip of the fibula, and it comes off the tip, and we should see it coming across horizontally right here, or obliquely right here. Instead, we see white, which is fluid. So this is a completely torn, ruptured anterior talofibular ligament. And there's fluid in this region we call the anterolateral gutter. There's another one back here that's intact, the posterior talofibular ligament. This is almost never torn, but ruptured anterior talofibular ligament. But that's not why I'm showing this case. This is really common. This is the most common ligament injury of the ankle over here. But on the other side, the medial side, there's a deltoid ligament that's right in this region. It's torn as well. And there's another finding down here. The tendons of the medial ankle, one of those, the posterior tibial tendon, is torn from the insertion. So that's why I'm showing this case. And here's 1, 2, 3 tendons of the medial side. Here's 2 of the lateral side here. These are the peroneus tendons, brevis and longus. And on the medial side, we have the posterior tibial tendon, flexor digitorum tendon, flexor hallucis tendon. We're going to follow this one down. This is the posterior tibial tendon. It's going to attach on this bone, the navicular bone. So we're going to follow it down, 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 and we just never see it attached there. There's this gray area, and on this view there's a little band of brightness, but can't quite see it attached nicely to the posterior, to the navicular bone there. Now we're going to look on a sagittal view to see if we can see it on the sagittal view. So this is the midline cut. We see the Achilles tendon here. This is lateral cuboid bone. We're going to go towards the central aspect. Now we're going to go medially. We're going to find that posterior tibial tendon here coming down, making this loop. And it's going to come down here, and we should see it attached to the navicular bone. But as we get to this far medial cut, we see the posterior tibial tendon coming down, and here it gets pretty thick, and it fizzles out. We see this band of brightness, and then here's the navicular bone. So this is a torn posterior tibial tendon from the navicular attachment. It's stripped right off, and there's a little bit of fluid there. You can see how this line comes down. It's not aiming towards the navicular. It's directed posterior to the navicular. So a torn posterior tibial tendon from the navicular attachment, among other things. Thank you very much.